Hey, what's up everybody, and welcome back to the Sanctuary. I'm your host, Professor C, and we're going to do some more A&P lecturing today. Specifically, we are going to check out the muscles of the anterior torso. To most people, we would call these chest muscles. So let's check them out. Muscles of the anterior torso. It's more than just the pectorals. Many are shoulder muscles that actually work to hold the scapula or the shoulder blade in place, or to put it in a position where you can get an increased activity when you move your arm. There are many actions to these muscles, including elevation, depression, rotation, abduction, that is to take away, adduction, that is to bring back, protraction, retraction. If you want to know what those mean, go back and check my older video on muscle actions, and I go over those in detail. We're moving the shoulder and the arm, and if you're having trouble thinking about what these actions are right now, just imagine these two guys here boxing in the background. By throwing punches and moving around and swiveling and turning, they're using a lot of these muscles of the anterior torso that we're about to talk about. Here's an overview before we get to the details, which I will show right after this. So deltoid is called so because it's shaped like, oid means shaped like, a delta, a triangle, and it's right here. I'm just going to basically show and tell right now before I show you all of the insertions and so forth. Now, the one that you usually think about when you think of a chest muscle is the gigantic chest muscle known as pectoralis major. If you're eating chicken breast, that's what muscle you're eating from the bird, is the very large pectoralis major muscle. Subclavius is as it sounds, sub underneath, clavius is clavicle. So it's kind of hard to show this one, but I'm just going to point to it right there, the little skinny one I'm running my cursor down. That is subclavius. Subscapularis, it sounds like it's under the scapula. It's a weird name for this, honestly. It's in front of the scapula. And I can do this to highlight it right now. It's right there. From this aspect, it looks like a little triangular thing. It does go a little bit further on, but it looks more triangular the further it goes. So there's subscapularis. Let me get rid of some of the ink. Pectoralis minor. Looks like a chicken foot to me. It's got these 1, 2, 3 toes sticking out. And I always teach it as the chicken foot muscle, and it usually works right away. Pectoralis minor. CORACOBRACHIALIS is this skinny one on the inside of the humerus there. Pretty easy to see that one. And then serratus anterior. Think about the word serratus, meaning like a serrated edge of a knife has barbs on it. So what we can see is kind of this jaggedy bump, 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 bump here of this muscle, and it continues all the way under and there, just like that. That is serratus anterior, and to me it's more lateral than it is anterior, but I'm not the one that named it, right? Okay, so let's look at some of the details of each of these. Start with pec major. Little close-up of it on the right. You would certainly use this in conjunction with other muscles, of course, to do some push-ups. So connections up here in the clavicle with the sternum, and then the costal cartilages here underneath. You're not really shown that very well, but wherever the costal cartilages connect with the sternum, you'll see some origination there as well. Attachment is in the humerus over here. A lot of people don't put that together, but this big pectoral muscle is to move the humerus. It's not in the intertubercular or bicipital groove, but it's on the lip of it right before you fall into the groove, right up there on the ledge. So many actions, again, usually having something to do with either positioning the scapula or turning the humerus in some way. I'm just going to say it's innervated by spinal nerves again without giving any specific branch names. So looking at pec minor now, very similar to what we just saw in the other image. It looks kind of like that three-toed chicken foot that I'm talking about. So we can see it more clearly here without the other muscles around it. Originates on the 3rd, 4th, and 5th ribs, and then kind of grows up, if you want to think of it that way, to the coracoid process on the scapula. And that is how it would move the scapula, specifically to stabilize it, or to pull up on the ribs to elevate them. All right, the famous iron cross right here is what this person is doing with these rings, a gymnast routine. Those bulging out right there are the deltoids. And again, it's a triangular muscle on the side of the arm. If it looks really developed, it's not so triangular. They will originate on the clavicle, specifically the acromion process, and some of the spine area of the scapula. Inserts on the deltoid tuberosity, which is about halfway down the humerus, and the actions are, as we've seen, to move the shoulder in some way. Spinal nerves innervating it like the others. CORACOBRACHIALIS, I can draw an arrow down here to remind us where it is, but this is one of those great ones where it tells you exactly where it is based on the name. Coraco referring to the coracoid process, and brachialis referring to the humerus. So originates coracoid, inserts the medial shaft of the humerus, is usually as much detail as you need, and of course it's to move the arm in some way. Alright, taking a look here at Subscapularis. Again, it should be, to me, called anterior scapularis, but I understand why they've done it. It basically covers the entirety of the subscapular fossa, so if you remember your bone names, this is an easy one to remember. It's going to insert into the lesser tubercle of the humerus, shown very nicely right here. And it will help you rotate and adduct, that is, pull back the humerus toward the body. It is innervated by spinal nerves as the others. This little fella here, again, right underneath the clavicle, would be called SUBCLAVIUS, and it will originate on rib 1 and some of the cartilage associated with rib 1. It's going to insert in what's called the subclavian groove on the clavicle, on the underside of it, and it will help, of course, move the clavicle and the rib. It can't do much else based on where it is located. The famous BOXER'S muscle. We saw the two people boxing on the second slide. Here's a single guy boxing a bag. What allows those boxers to punch with those forces that they punch with? It's not necessarily the muscles that you think about, although it is some of the arm muscles. One of them is this guy right here. It's on the edge of the rib cage, called serratus anterior. And down here is a great picture I'm circling, those serratus anterior muscles just jumping out. That's what looks scary to me when I see one of these fighters standing there before a fight. He doesn't look very big. If he had his shirt on, you probably wouldn't be that scared of the guy, to be honest. But if you could see those serratus anterior muscles bulging out, you know that guy can throw a good, strong punch. So you might want to watch out for him. So there's the name of the muscle. Again, named so because it's got this kind of serrated edge, like a serrated knife would have. It's on the, I know it's on the lateral edge. It's still confusing to me too, but it is called serratus anterior. So it will originate on the lateral surface of the first 9 ribs. Sometimes it's only the first 8, but usually in the text you see 1 through 9. It will insert at the angles, both the superior, which is up here, and the inferior, which is down here, the 2 angles of the scapula, and this medial border here, which of course is also known as the axillary border. So it's going to grab onto the scapula, and of course it will move it. Protracting and rotating the scapula, of course, would help you, if you're a boxer, to do those specific moves where you jab forward and turn your wrist to punch. Alright, thanks for watching that one. Check out some more videos if you want to learn more about A&P, and I'll check you for the next one. Bye-bye.